Hello, everyone, and thank you for joining today's webinar. Is disorganization costing you money? So the reason we've put this webinar together today is because we found most of our interactions with clients leaving their system and coming to ours is because there seems to be issues revolving around three of these areas: managing their AR, patient tracking, and overall document management and storage. So before we begin, I would like to introduce myself, my Dave, the company, and the software that we will be reviewing today. So who are we? My name is Curtis Watkins, and I've been a sales executive for iCare Leaders for 3.5 years now. I'm based in Northern Arizona, where the wind just never seems to stop up here. Joining me today is Dave, who is also a sales executive at iCare Leaders and has quite the tenure of 13 years here at iCare Leaders. Dave is based out of Pennsylvania, and you just got a bunch of snow up there. Am I right, Dave?
That is correct. It's starting to melt today, but we got about 3 inches last night.
That sounds like the holiday season's just around the corner, so that's good. I'm jealous. We don't get anything like that out here. So I mentioned iCare Leaders, but who are we? iCare Leaders is trusted by more than 9,000 ophthalmologists and optometrists in the field today. We are the #1 source for premier ophthalmic specific solutions. We provide software, but we also fill other areas of the practice and provider needs, such as revenue cycle management, online marketing, and MIPS services. Today's topic of this discussion is in connection with iMedicWare. iMedicWare is a fully integrated, web-based EHR, practice management, ASC, and optical solution backed by Amazon Web Services Cloud System. You may have seen a few articles circulating out there from Forbes and Business Insider speaking to how we are one of the first healthcare software providers to fully go onto Amazon Web Services Cloud System. So it is quite the exciting time for us here at iCare Leaders. So going into today's topics again, is disorganization costing you money? We're going to start off with the first topic. How do you currently manage your AR? So clients coming to iCare Leaders have expressed frustration in their current setup as it was not helping them manage their AR effectively. So oftentimes we found that our clients have had a clunky or difficult to navigate workflow that they could not change simply because it was a dedicated part of the system. So oftentimes they end up going to Excel spreadsheets to help tracking on the other end, or the dreaded paper stacks in the filing cabinets or on the tables. So the issue with this is that our clients were telling us that there wasn't a focal point that they can look at all of their AR data and make decisions and work through it in a timely manner. When iMedicWare was developed, we came up with the AR worksheet to fill this gap. So the AR worksheet is a powerful tool that is integrated into iMedicWare, built exclusively for the billing team. The worksheet will allow users with the billing role to easily navigate outstanding AR, resubmit claims, or delegate tasks all from one window. The really cool thing about this is because iMedicWare is a cloud and web-based system, trusted team members of your practice can work from home and utilize this tool, which in today's ever-evolving landscape of issues popping up, that's a big plus. So we've spoken about it, and I just want to show you kind of what it looks like. This is our AR worksheet, and you can see here we have our insurance carriers on the left-hand side, and we have data ranges ranging from 0 to 180 broken out into columns, with a total balance on the far right-hand side. Now, each of these fields can be modified to show from the highest or lowest balance. And you also have a filter here where you can run in-depth reports that will allow you to see the information you want. When we click this open, you will get this pick list to choose from. And this really does allow you to get granular. If we want to look at a certain provider's rejection rate for a certain CPT code for a certain carrier at a certain time of the year, we certainly can do so. And the report is then saved for easy viewing at a later time, so you're not duplicating your efforts moving forward. Back to the AR worksheet, you'll see here all of our carriers are listed here. If I were to select United, this brings us into the United payer. It shows us the fax and telephone number, and now it shows us all of the patients that are in United Healthcare along with their date of birth and the charges ranging from 0 to 180. We also see the balance on the right-hand side again. Now I have this filtered to go from the highest balance ranging from 90 to 120 days. Because of this, Eli Tomac is at the top, and that is the patient that we're going to select to show more of how the worksheet works. When we select Eli Tomac, now we will see all of Eli Tomac's date of services, where the date of service occurred, the insurance ID and the CPT with ICD-10 codes, and the charges along with the balance and what type of insurance it was. You'll also see at the bottom a number of buttons are now available for us to use. By selecting the certain fields that we would like, we can get additional information. So if I wanted to look at this column in a more in-depth patient view, I could look at their accounting ledger by clicking there and now going into the patient's accounting ledger. Similarly, if I needed to write off a certain claim, I could do so. I can resubmit the claim directly to the clearinghouse and package it up to the payer. I can do that for all the claims as well. If we need to change the status, we can certainly do so as to if we are working on this or where we are at in the process. If we need to delegate and assign this to billers who are working, we can certainly do so by selecting the Assign To button and sending them a direct message to their profile. We can also set follow-up dates for us to revisit this if we need to. And last but not least here, we can send out collection letters. So this is similar to consultation letters. It will be in the same module. We can send out those collection letters directly to the portal or print them out and send them. It's also worth noting here, the claim, if we need to print the CMS 1500 or the UB04 forms, we can print those out directly from here by selecting the claims we want and then printing them and moving forward. We feel that this is a very valuable tool for the billers and the billing team as it gives them direct access to the information and it allows them to make real-time changes wherever they are as long as they have an internet connection. Now, moving on to our second topic, this would be tracking patients. Tracking patients is another key area that we see our potential clients needing assistance with. We all know that patients go through multiple touch points, and there is a treasure trove of data within those touch points that most practices are not capturing and using. Now, this can have an automatic impact to the practice as we are not taking that data and we are not using it in a constructive way. We've also found that if a patient's wait time is longer than their current expectation, it can lead to a negative experience and ultimately lead to a negative review. I believe it's 4 or 5 times more likely a patient is to leave a bad review based on a bad experience rather than a good review on a good experience. And we all know that to be true because even Disneyland doesn't have 5 stars nowadays, and that's the happiest place on earth. So because iMedicWare was built by ophthalmologists for ophthalmologists, the system has a built-in patient tracker called iMedic Monitor that is there to fill the gaps and ensure that the patients are receiving the highest level of care and the practice's staff is set up for success. The iMedic Monitor allows for real-time patient tracking the moment they walk through the door and start paperwork with the front desk to the moment they're checked out from the front desk with their prescriptions and their services. Because the system is fully integrated, the data that is captured can be viewed multiple ways and help make granular level decisions for the practice, workflow, and patients. There's also a huge benefit to the office administrators or whomever is doing the end of year MIPS reporting this is something that can absolutely help them with the improvement activities category. And it's something that's built into the system that doesn't need additional time taken away to monitor it. And I will speak more about that as we go on to these next two slides. So what I want to show you is the iMedic Monitor at a glance. And what we're looking at here is the dashboard. We see our facility and the provider we're looking at now. Now you can have multiple facilities, you can have multiple providers at any one time. With our system, it is cloud-based and you do have unlimited storage. So there is no fear of outgrowing the system that you currently have. We are looking right now in the normal view, and that's going to show us these 5 different buckets. This bottom left bucket is for scheduled patients. This bucket on the right here is the patients that are checked in and are waiting. We have the patients that are active with the technicians currently. We have the patients that are active with the physicians currently. And here on the right side, we have patients that are currently under dilation or any sort of testing. We'll see here that we have a timer. This takes the guesswork out of the dilation. No longer are we looking down at our watches or up at the clock trying to figure out how many patients have been dilated and what the times were, and we hope someone wrote it down properly. This information is readily available. It's important to note that because iMedicWare is cloud and web-based, you can have multiple windows of the system open at any given time. So if we're using a workflow where we have a monitor in the back for the technicians and providers to view, this can act as a great screen so the practice gets a good view of where the patients are at any given time. When we move our view from normal to extended, this is where that treasure trove of data is uncovered, and it allows us to make in-depth granular decisions. So we can see our patient's name along with the appointment type. We can see the appointment time, when they arrived and when they were checked in. How long did they spend checking in? When they were worked up with the tech. How long did dilation take? When did the doctor start and end? How long was the doctor in with the patient in general? This information is fantastic. Not only does this help the practice, if a technician is having a certain bottleneck with a certain appointment type, that is a great learning opportunity for us that we would not be able to see unless we had the data. Moreover, if there was bottlenecks at the front desk during a certain date at a certain time of the day, we can see that information here, and because it's reportable, we have that access immediately and can make those changes that will affect workflows and processes for the better moving forward. I mentioned the improvement activities and how the iMedic Monitor can help with that, and anybody who files for MIPS, especially in that improvement activity category, knows that you need that benchmark in order to say we are making improvements. This works perfectly for check-in or check-out times, times with technicians, times with doctors. We have that information readily available to report on, and then when we make those small changes, we can see those changes happen in real time rather than being tasked with trying to manage those on an Excel spreadsheet or in a notebook. It's right here in the system readily available for you. So the iMedic Monitor is a fantastic tool that a lot of the clients coming to us with patient tracking problems, they're finding much relief from using this tool. Last but certainly not least, patient documents. And overall, how are documents handled and how are patients using the portal to the best abilities? Patient documents can be very time consuming, especially at the first touch. And even if the patients aren't given an opportunity to fill out the forms before they come to the practice, if there are multiple forms, the patient may not show early enough to complete them without interrupting the day's schedule and causing a cascading effect. Also, education material can become an oversight if that does happen. We've all been there and we are not machines. So sometimes things do get missed, and unfortunately that impacts the patient. Something else to consider, by not utilizing a portal to its fullest extent, it can have an impact on the promoting interoperability category when it comes time to file for MIPS. So not only is it best practices to have a very clear and concise hub for your documents, but it's also best practices to maximize the rate of return you're going to get for your positive adjustment. So we found out that a lot of these clients are experiencing issues in these areas. So our documents and portal is where we come in and we make things less clutter and a lot easier to control. First off, our system's web-based. We have adaptive screen control technology, which allows the system to be viewed on anything that is web-based, a tablet, a phone, or a computer. We're seeing a lot more of our iMedicWare clients now using tablets as a check-in kiosk sort of method, so patients can fill out their forms, sign up for their portal, and move on through the process before they're seen in the back. What's nice about our system is that the patient has the ability to sign once, and that signature is then saved in their profile, allowing for easy one-tap signatures for any of the forms that we give them, just decreasing the time spent on forms. The patient documents are then saved to the cloud and can be accessed through the document center and the patient's portal. And we're going to just take a quick look at that document center. So we're going to still have our patient Eli Tomac here, and this is our hub. We see we have multiple folders to choose from on the right, and if we open them, there's more information. So for now, we're going to stick with the templates just so we can show how the front desk flow would look. When we open up our template, we can open up our multiple consent template folders and then pick the one that is required. So for this example, we'll use the front desk, and then we can use a contact lens consent form for that. Now, you can have as many forms as you want. You can have as many folders as you want. You can have all the different types of variations as well. We can provide a library, or you can pull them over from your current setup. But once they're in here and the patient signs, they will then reside in the sign folder. Again, we can have the different folders representing different areas, and then it will show the dates when the consent form was signed. Now, if there is a time where the patient cannot use the web form to fill out the information and they must use a printed form, all of the forms will come with a barcode on them. What this is meant for is that when it is in a paper form, you can use a barcode scanner to scan the PDF form, and it will take you directly to the patient's document center so you know where to scan the document in. It's just another time-saving feature that we've implemented into the system so that we're taking less time away from the technicians trying to use the system and just make it a little bit more user-friendly. I also want to just review patient education material here. In the patient instruction documents, this folder given to patients will detail the dates and it'll detail the dates and what was given for that specific date. Now, we are partnered with AAO for all of our education material, and we update it with them regularly. So you can rest easy knowing that your patients are getting the most up-to-date, comprehensive information out on the market about the current disease that they're facing. This also can get sent directly to their portal, which allows them to review their education material, and they can also look at their signed consent forms from their patient portal as well. So I just want to quickly show you what that looks like from the patient side. The signed consent forms will reside here in our Forms tab. This is where they can see their signed consent forms throughout the life of their time at the practice. And then we can also see here in the education material where the education material is coming from and what time and date it came. Now, it's also worth noting our portal is fully integrated to the PM and the EMR. So if the patient wants to update their demographics, such as guarantors, family members, or insurances, that information can be pushed to the PM and can be updated with the blessing of the administrator. The same goes for medical information. This is a very powerful tab for patients that can update allergies, medications, surgeries, medical history, and more. And if the patients get into a rhythm of updating this information before visiting the practice, we can cut down a lot of time spent with patients and ultimately end up fitting more patients in the day schedule as we're utilizing the system to its fullest extent. Now, I did mention promoting interoperability as a potential impactor for not properly utilizing the education material and the consent forms. By using this, you will have checked all the boxes for the promoting interoperability category, as your providers and your patients are all connected through the portal and the system. So today we've reviewed managing your AR, how to track patients overall, and document storage and patient portal. These were some of the key areas that we've had from clients coming to us trying to solve problems, and we thought we would share this with the group. So for everyone who's joined us, I want to take this time to have any questions that anyone may have. Please just send them in and we can go ahead and answer them accordingly. Also, you can reach us at iCareLeaders.com, where you can see all of our information about all of the suite of services that we provide, as well as the softwares we provide. You can reach me at curtis.watkins@iCareLeaders.com. I manage the West Coast territory and be happy to answer any questions that you may have about the system. You can also reach out to Dave Boer. Dave Boer manages the East Coast territory, and he is also a valuable asset that can answer any questions that you may have as well. So I don't see any questions here. I do want to thank everyone for taking the time out of their day to join us and see this presentation. I hope you all have a great Thanksgiving, and thank you for joining.